viewer had asked me to explain about toilet training in children. Let us see about toilet training in today's video. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, health related explanations are given via simple videos which are released every week. If you want to see such videos, kindly subscribe to this channel, and if you want any explanation, kindly mention it in the comments below. I'll try to put videos for them in subsequent weeks. This week's video is regarding toilet training in children. Okay, so toilet training is training to use a toilet for their defecation, that is passing motion, as well as for their urine needs. So this should be attempted when the child is ready to be toilet trained. That's the crux of the matter. Okay, so it is not an universally fixed timeline for this. Roughly, children get trained between ages of 2 to 4. You can start by probably around 18 months of age, because at birth child is not ready. No, child passes whenever it is full. There is no voluntary holding patterns. So once this voluntary holding can be established, then only you can train the child for toilet. So how to know that this is established already? So when the child starts signaling your toilet behavior. So when the child starts ready to defecate, the child gives some sort of signal, parents understand this, so that should be ready. Second, child should be able to obey simple commands like sit, stand, come here. So those sort of simple commands the child should be able to obey before you can start toilet training, and they usually remain dry for several hours at a stretch. So then only you can start toilet training. For all these, the rough age is around 18 to 24 months. Usually they are able to be trained for defecation, that is for their stools, by 2 to 3 years. For urine, it may take little longer, by 3 to 4 years. And in fact, up to 5 years, if they are not continent completely, it is okay. Beyond 5 years, it is a problem. It can be a medical issue. Okay. So we have reached that age. So how to train my baby? Okay. So initially you have to make them sit in that potty chair. So it can be an independent potty or made to be fixed over your existing commode. But anyway, the child should be able to made to sit on that commode, probably even with their pants on initially, just to make that habit. The child has no fear of potty for 5 to 10 minutes. Once the child is ready for this, then the child can be made to remove their pants and then made to sit. And then once they signal their needs for passing motion, at that time that potty, they can be made to sit on that potty chair or over that potty. If the child refuses to do so, you gently coax them. You can incentivize them. So you can give their favorite toy. If you sit on that potty, this toy will be given to you. You gently incentivize them. Never give negative reinforcements, that is punishments. Toilet training never should be aggressively pushed. Okay. So this period of training may take somewhere between 3 to 6 months, even up to 1 year. So seemingly a trained child can miss, can fail. Again, not a problem. No negative reinforcements, no punishments. A completely toilet trained child also, in case of emotional problems or physical problems like an illness, can again fail. Again, no negative reinforcements, no punishments. Aggressive toilet training is the reason for many problems associated with this, like a constipation or a urinary incontinence. So there should be no aggressively pushed toilet training. Be gentle with them. Some children may not show consistent behavior for expressing their needs. So what can be done for them? So you can time them. Like what you can do is ask them to sit on that potty after a meal. Usually after a meal you have strong gastrocolic reflex, something in the stomach dilates your colon, so you are ready to defecate. So that's the ideal time to make them sit, especially after a breakfast, say 10 to 15 minutes after a breakfast, make them sit for 5 to 10 minutes, they might start to follow that pattern. But if they are absolutely adamant, refusing to sit in the toilet, sit in that potty, wait. Now postpone this toilet training by few weeks, say to 1 to 2 months, and then start to train them again. Don't ever aggressively push them for toilet training. And when you do ask them to sit, be consistent with what you do. Beforehand itself, you must be able to explain that to pass stools, you need to sit. Use simple language to what they can understand, and use a consistent behavior among all caregivers. If a father uses some name for stooling, for a mother uses some other name, it might not be consistent. So use a consistent behavior by all caregivers. Use simple commands, simple requests, and ask them to do so. They will come around in a few weeks to months. Hopefully this video was useful about toilet training. If you found this video useful, kindly share it among your friends and relatives. If you want to see such videos, subscribe to this channel. Till we meet again, bye.